I think every one of us is anxious, not only in Australia, where we are doing relatively well. When we look at overseas situations, it's even more frightening. So the COVID-19 shutdown stresses, they relate to, just genuine threats to our health. They also threaten the economy with job losses, and in particular with mental health crises. Yesterday I heard of a modelling where they believe that huge unemployment may strike youth, and there will be a possibly very large increase in youth suicide. Now that's a modelling thing, but still it does speak to not only things like suicide, but domestic violence, large number of calls to online services providing help, because the nature of the situation is that we're all stuck together. We're stuck in lockdown situations where whatever stresses are within that family, they're going to really be tested. Now, from a clinical psychology point of view, I'll be mostly reflecting on cognitive and behaviour strategies. And we know that anxiety is a normal part of our lives. It's a normal emotion, but it quickly becomes abnormal if it's triggered too easily, if it's lasting too long, if its intensity is very high, leading to symptoms and panic, and if it just interferes with how we function. Now, clearly we've got a present danger in the COVID-19 epidemic or pandemic that makes us go back to our basic principles in trying to deal with anxiety. So it's a normal, alerting emotion, but it can very quickly become out of control through loss of control. So when we are in control of our situations, that's how we thrive and flourish. But when we feel out of control, so many stresses arise as a result of that. Now, because anxiety is it's a basic defensive system that we have. It's one of every living organism has a defensive circuitry of some kind. I mean, those that have got a brain anyway. So we've got the most developed circuitry of defense, and our attention to fear and doubt is so powerful that it locks us down. Now, when we look at the CBT model, we try to help people to think clearly about the triggers and the thoughts and the emotions that they're having. We try to help them to manage their feelings more appropriately. And the third thing we try to do is to help people to engage in life. So psychological first aid is really about thinking clearly, not blowing things out of proportion, but being able to exercise that kind of calmness and common sense that enables us to settle our families and to follow the advice that we're getting, which is very sound advice, and it's the way in which we can stabilise our lives. We have to also look at the destabilising effect of stress, because we can go from when we have say a traumatic event, a person's stress ability is destabilized. So our emotional life can swing like a pendulum between almost normal, we're not fully normal, but within seconds it can swing like a pendulum to where we feel totally out of control. Now, when we're in that situation, we have to have a way of stabilizing ourselves. So CBT looks at trying to help people to think clearly about the triggers. What is it that is bringing about the distress for them? Because everybody has got their own story. Every family has got its own particular degrees of difficulty. And those families that are troubled by, say, personal stress or a disabled child or difficult adolescence, they're all going to have a different response from those families that are able to organise themselves. So we have to try to say to people that are struggling in this way, please look for help. And there is lots of help. COVID-19 shock to us all. I'm getting a message, my internet's unstable. Is it still coming through? Can you hear me, Jim?
I can hear you.
Can you hear me, Jim? Sorry, I just got a message that the line wasn't working very well.
I can hear you.
If we could just put up the slide about the types of anxiety, I'd like to make reference to that. Yeah, so swing to the next one. So what I'm wanting to point out to people is that when people are anxious, they don't want to have any anxiety, any tension, worry, doubt or fear at all. So the major reaction to anxiety is avoidance. And what we have to try to do to help people is to recognise that this is an oversensitivity to anxiety. And so what we want people to be able to do is to develop their own profile of anxiety. And one way we do this is through the subjective unit of distress scale. Some of you will be very familiar with this, some of you not so familiar. But the easiest way to understand it is 0 to 3 is low levels of anxiety. 4 to 7 is moderately high levels of anxiety. And 8 to 10 are extreme levels of anxiety. So what we are looking for is what kind of symptoms we're experiencing. What are those triggers for those symptoms? And have we got the capacity to kind of manage it? So for example, we'd encourage people that anything under 5, from 5 down, we can feel this definite tension, but we can still manage to do what we have to do personally and socially. It's only when we get worrying thoughts, physical symptoms, and definite interference with our social and personal functioning that the problems are interfering with our life. And then obviously the last level is the panic attack or the worst type of experience of anxiety that you've ever had. Now, we also need a model of understanding what anxiety is, how it's working in our lives. Now, it's an alerting emotion, it switches us on, it keeps us focused, but it is also disruptive of emotional balance, and it leads us to impulsive and loss of control situations. So we mentioned before about the increase, say, in family violence or maybe the increase within the family of just tension, arguments, impulsivity. We may have noticed that they allowed alcohol outlets to remain open throughout the shutdown, and there's some evidence that there's been a large increase in the consumption of alcohol. So perhaps there are families where this has affected their capacity to organise themselves, manage the difficulties, and get through what is such an unusual circumstance. So the kind of model that we're talking about is, as I mentioned earlier, trying to use common sense and follow the guidelines. If you are feeling stressed, to make sure that you turn to those sources of support that are available through the use of the telephone, the use of Zoom. And this is a remarkable thing that's happened. It's going to change mental health delivery, that we are now able to actually speak to people from anywhere in Australia and continue to support them in exactly the same way as we would on a face-to-face basis. It's going to transform health delivery, in my view. Now, so a person has to judge when is there a need for outside help, and that's going to be along the lines of this subjective unit of distress, where there are symptoms, where there's impulsivity, arguments, anger, and kind of threats of violence. You have to turn for help from outside, and there are lots of sources of help ranging from online, telephone, to Zoom, to helplines like Jim mentioned at the beginning, and Lifeline. Now, I want to talk a little bit about another model of understanding what's happening to us, and that is a model that was developed by a GP in Sydney, and her name is Claire Weeks. She's an Australian doctor, and she talks about how stress and whether it's trauma, whether it's an illness, whether it's following an operation, whether it's to do with what the kind of thing we're dealing with now, that the body becomes sensitized. And when that happens, this sensitization impacts on a person's capacity to function. So there's a bewildering array of symptoms that will come. And that can, as I mentioned earlier with the other model of the pendulum swing, in sensitization, a person is overwhelmed by a bewildering array of symptoms, which might include panic, tension, nausea, dizziness. But her view is that once you can unwind and reduce that sensitization, the person will return to full functioning. So her model is one of where she believes that people with heightened anxiety are not disturbed in the sense of serious psychiatric disorder, but they are out of kilter, and that their body is waiting to recover, no matter how long they have been in this state of distress. Now, Claire Weeks is, a book was released on her work, on her life last year. I remember using her material when I was working in the 70s and 80s, and it's certainly a very good way of managing anxiety. Now, she has anticipated the current mindfulness approach, and she had a simple formula. And that formula was that a person had to face the symptoms that they were experiencing, just as we today would call it exposure. They then have to accept that this is to be expected. And if we can apply that to our current situation, it is expected that we are at risk every day when we're moving out among our fellow man. We're at risk of picking up this virulent virus. And this is not something that's never happened before. We have a long history in Australia of dealing with virus-driven conditions. But whilst we're in the moment of it, the threat of it is so palpable that it is really causing such distress. But what we're saying is that over time, that will pass, because our authorities, our medical authorities and researchers have shut down Australia to such an extent that we're not experiencing the chaos and the terror that's been experienced in other countries. And there's every reason to believe that we will continue to maintain a sufficient level of dealing with the virus. Now, what we're talking about, however, is our subjective response to it. If I could just have the next slide, please. So when I'm talking about Claire Weekes's approach, it's very similar to one that I will discuss here with you now, but she talks about, first of all, face your fear, put it in perspective. You've got to accept or acknowledge that it is part of your life, but it's not all of your life. We still have to live and relate and help and be human. But we've got to acknowledge that we've got to change. And those changes are very clear. Keep your social distancing, keep your hands clean, don't touch your face. And when we do these wise things and teach our children to do them, we are in a position to manage this virus effectively. Now, when we talk about the word aware, what I'm meaning here is a very effective way to manage anxiety is to have on hand a small card where you have a few words of support for yourself. And so we can say, I've got to accept this emotion that I'm experiencing, whether it's panic or hurt, fear or worry. I've got to acknowledge it's part of me, but it's not all of me. The second level is I've got to watch the level of it in that way I explained a moment ago. 0 to 3 is low, 4 to 7 is moderate, and 8 to 10 is extreme, just at that overwhelming state. Now, what we've got to try to do is tough it out, like lean into it, act as if I can handle this. And we do this all the time. We try to tough out situations. It's not a permanent solution, but at the moment or at the time, it's facing and leaning into the problem. The word R refers to relax. You've got to try to use relaxation techniques, which I'll explain in some detail now. And finally, you've got to expect this to happen again, but it's a passing thing. Let time pass. And this aware strategy enables you to just pause, settle, and deal with the problem. Now, when people come to our clinic for anxiety, we always focus on self-management. And one of the ways we do that is through breathing techniques. Now, in our society now, mindfulness has become a very popular concept. And these breathing techniques are anxiety management techniques that come from all over the world. So if we have the first one, which is called the breath count, what we're trying to do is get people to breathe between 10 and 12 breaths in a minute. So when we're functioning at that level, we're really enriching our body in terms of oxygen exchange and carbon dioxide, and the body is functioning really well. Now, this breathing exercise is along the lines of the mindfulness approach, where it's simply rise, breathing in, fall, breathing out. So what you're doing is you're simply observing your own body rhythm. The rise of the chest wall as you breathe in, and the fall as you breathe out. Now, this exercise is a very brief thing that you can learn that can change the way in which you handle distress and anxiety. It's a new learning, but it needs to become a daily practice. And the importance of a new learning like this is that when you first start it, it only goes in to your short-term memory. But over time, if you continue to practice these short forms of breathing, they become long-term new learnings which are permanent and challenging to the upset that comes from a surge of anxiety. So we will get a surge of anxiety, but it will pass. You will get a surge of anxiety like an electric shock almost, but that will pass. And over time, repeated presentations and continuing to face the thing that is difficult for you, it brings about a reduction in that anxiety. In the same vein, we have to understand that the symptoms of anxiety are about hyperventilation. So if somebody comes to for help with anxiety, they may be breathing at 2 or 3 times the normal rate of breathing. And all of their anxiety symptoms are explainable by excessive carbon dioxide in their system. And so they can feel pain in the chest, they can feel dizziness, they can feel nausea. Everybody has got their own personal signature for tension, whether it's in their stomach, across the forehead, grinding their teeth, unsteady on their legs. Now, Claire Weeks says you just push through it, allow time to pass, and these feelings are only short-term. So in our experience, it is important to have your own sense that anxiety is a normal emotion, but that we can be so sensitive to it that we don't want any anxiety at all. Now, what we want you to do is the opposite of that. We want you to push yourself to experience anxiety and notice that it passes. Jim mentioned my book, and in my book I do describe a deep chest breathing exercise, which is aimed at teaching people to become less sensitized to symptoms of anxiety. And we do this, and you can do it through running, you can do it through bike riding, but the idea is to promote deep chest breathing. And with that, over a period of time, a person will develop a capacity for recognizing that symptoms of anxiety will pass over time. You don't have to take excessive, like some people who have got comorbidities may require medications to help them overcome, but we're talking about straightforward symptoms of anxiety. Equally, people can find that if they turn to other activities, that can help them distract themselves from the effects of anxiety. Could I have the next slide, please? Now, in this slide, we're talking about what is essentially called the mindfulness approach. Now, what we want to do here is people have to have a goal. Now, if you think about people at home now, they need structure. So they need to have a routine where they spend a certain amount of time on their work, time with the children, taking a break to ease tension. And this focusing technique that I have here is that when we are focused, we need a target. Everybody needs a goal or a target, and just a 20-minute goal in terms of spending time on a topic. Now, we try to put 100% focus on that task, but the mind wanders. We expect that to happen. You don't criticize yourself when your mind wanders, but when you notice it, you just refocus back on the target. Now, this is what happens in mindfulness training. We expect it to wander, and we just go back to our target behavior. The fourth step is repeat that mind wandering, and you notice it, refocus. This is the secret of life, is you've got to refocus on your value-driven target. And you keep doing that several billion times until it becomes a fixed memory in your, you've heard about plasticity. This is what we're talking about, a deep learning in your working mind, which enables you to develop a focus which keeps you being a lifelong learner. The last point is, what is distracting you? What is distressing you? We've got to problem solve. What's the problem? Have I got a plan? Am I keeping to the plan? If I'm keeping to the plan, I'll see progress. If I'm not keeping to the plan, I might need to adjust it. Next slide, thanks. We're running out of time, I think, Jim. Now, in terms of the most important message that I would be trying to bring to you today is that anxiety is best managed by building relationships. Some people believe that insecure relationships are the basis of people suffering emotional distress. So they may have experienced trauma as a child, they may have insecure attachments. And what we have to recognise is that we can develop by our own practice the capacity to feel I'm okay and the people that I'm dealing with are okay. And so we can establish a kind of bond between them where there's a caring and a kindness. Now, no matter where this operates, whether it's in the workplace, we don't want competitiveness, we don't want bullying, we want people to be aware of each other, supportive of each other, and caring about each other. Now, this time of ours where there's so much distress and genuine pressure, it's good to be able to lighten up. So the idea of bringing humour and to being a person that is good to have around. Now, you don't want your life made up of kind and caring, fun-loving bimbos. You want people to be competent. We want people during this time to bring out their best game. In other words, that people do what they say they'll do. So if I say I'll meet you at 4, I'm there at 4. If I put the garbage out, I put the garbage out. So any family that is running on those very simple principles of caring for each other, of lightening up and sharing and laughing together, and there's been a large increase in board games, I believe, and a large increase in Skyping and Zooming across to friends. But most of all, the family will run better if people are working as a team. The people are doing what they say they'll do.